Hello, my name is Rika Emba. I'm a third year nursing student and I'm here to demonstrate chest tube dressing change. I already got my doctor's order and reviewed that. I checked that it is due to be changed now, and I also checked my patient's chart. I made sure that I had the right patient. I checked their identification and their allergies. I also checked the last analgesic dose that they had. I also checked the procedure policy for this, and I will now go to the patient's bedside. I will make sure that I have all my supplies gathered. I'm just gonna wash my hands, and so I'll do my safety check. Patient's not in distress, bed's in the lowest position, no safety hazards, and then I'll fully come in. So hello, my name's Rika. I'm your student nurse today, and I'm just here to change your dressing for your chest tube. Is that okay with you? The patient agreed, so we're good. I'm just gonna check your wristband right here. Can you give me your full name? Okay, Manny Quinn. And when is your birthday? Perfect. Do you have any allergies? No, and that's what we have in our chart as well. So, Mr. Manny Quinn, just like I said, I'm just here to change the dressing on your tubing right there to make sure that it's still dry, it's intact, and it's not having any infection going on. Is that okay with you? The patient said yes. Do you need any pain medications? The patient refused. They said they had this procedure done so many times before and it's not really painful for them. So now we're good. We're just going to make sure that the patient is in a semi-phallus position to promote the drainage into the tubing right there. And now I'm just going to set up my table on making sure that it's in my waist level as well as the bedside. So now I'm just going to wash my hands, and I also made sure that this has already been cleaned as well. So I'm just going to take out my dressing tray. I'm going to use this as my garbage bag. I'm now going to open it while maintaining sterility. I'm only touching the 1-inch border. So I'm just going to open that like so. There we go. And I got my sterile blue forceps right here, and I will be only touching the 1-inch border right here as well. So I have my extra sterile drape. I'm not going to need that for this procedure, so I'm just going to put that right here. I'm just going to put that into my garbage in there as well. So I will be taking my sterile forceps and push that tip to tip, as well as this one. So tip to tip, like so. And now I have my extra garbage bag right here. I'll be taking that like so. And 1-inch border right here. There we go. And this goes to the garbage as well. So now I will be adding my drain sponges. I'm just going to step away from my sterile field when opening it. And just going to use my forceps to take that out, making sure that my gauze is just in my sterile field as well. It's far from my 1-inch border, so this goes to the garbage. And now I have my Jello net. So for timer purposes, this is already opened, but in reality, we will be using a new one. So I'm just gonna make sure that this doesn't flap back. So I'm just gonna open it like so. All right, and I will be using my metal forceps for this one because the blue ones tend to get really flimsy. So I'm just gonna put that right here. So just gonna take that out and making sure, just gonna take this, then pull it straight up. This goes to the garbage as well. So now I'm just gonna make sure I'm gonna put it on my sterile field and it's far from my 1-inch border. So right here is good. And now I'm just gonna put this back right here. There we go. So now I'm just going to wash my hands again. I will be opening my normal saline and making sure that it's intact. It's not expired as well. And we will be pouring it from a good height. It doesn't touch the tray and it's not splashing anywhere as well. So we're good. And I'm just going to put this aside for now. So I'm just going to wash my hands again. There we go. And now I will be donning clean gloves while making sure that I don't turn my back away from my sterile field. So now we will be assessing the site for any subcutaneous emphysema. So I'm just going to touch it right here, and I will make sure that there's no subcutaneous emphysema. And now, Mr. Manny Quinn, I'm just going to take out your dressing. Just going to peel this off while stabilizing with my left hand. All right, so just going to do it like so. All right. Just going to tuck that under. There we go. I'm just going to make sure we're going to take out the tenting right here so it doesn't get stuck in there. And we're pulling towards the site as well so that we don't accidentally pull the tubing. There we go. And we're just going to do it like that. Take out the tenting right here. And we are just going to slowly slide that dressing while not tugging on the tubing. Just gonna take that out as well. We are still stabilizing with our left hand, like so. And now we're just gonna take out this part right here, and we're still stabilizing with our left. And we're just gonna observe this dressing, this old dressing. There's no exudate. I don't see any purulent drainage as well. So just gonna put this in the garbage together with our gloves, like so. And that goes to the garbage. I'm just gonna wash my hands again. And now I will be putting a new pair of clean gloves. And I'm just stepping away from my sterile field as well, but making sure that I don't turn my back from that. So now I have my blue forceps right here. I'm going to use that to take my old gel net out. So this touched the patient, so I'm just going to put that right there in the garbage. My gloves are still clean. It hasn't touched the wound at all, so we can still use it. And now I'm just going to take our sterile forceps right here. Just going to move this to the side, making sure that it's still within our sterile field. It's far from our 1-inch border, so we can still use it. And now I'm just going to use my 4x4s right here, making sure that they only touch the forceps. Okay, to maintain sterility, I'm just going to make a rosette. And I like to use the 4x4s for cleaning this area so that we can have a large surface area for this, and we have a larger area to work with. So I'm just going to wring that out to prevent any maceration on the skin, because we don't want it to be causing out breakdown because it's too wet. So I'm just gonna put that in here, 1-inch border. I'm just gonna stabilize here again and do a circular motion, drop that. And at this point, we made sure that the patient knows that they should stay as still as they can, so that to prevent any tugging or prevent the tubing from getting pulled. And now we're just gonna make a rosette right here as well, maintaining sterility. There we go. So there's a rosette. Just gonna bring that again. Bring it out, bring it out. And 1-inch border right here. There we go. Do one more circular motion swipe. There we go. And making sure that only the gauze touches the patient. So now we have one more right here. Just gonna do it like so. Gonna dip that in there. There we go. And 1-inch border. Very good. So one more swipe. There we go. And drop that. So now we're gonna clean the tubing with our 2x2s. So just gonna put it like so. To my rosette. Dip that in normal saline. Bring it out. 1-inch border. And clean that from the side downwards, so clean to dirty. And I drop that in there as well from a safe height. And now I will be making another rosette, and this time we will be cleaning the bottom part of that. So 1-inch border, there we go, and we will be cleaning this part right here, and just gonna drop that in there as well. So now we're just gonna dry those sites. The stuff that we just cleaned, we're making sure that we're only touching using our forceps. There we go. Just gonna take these out right here. There we go. Now I'm just gonna clean in a circular motion like so, and drop that. And I have one more here to clean that site. Okay. There we go. And 1-inch border. Clean that. Drop it. 1-inch border again. So there we go. And then 1-inch border. Clean one more right here and drop that. So now we are gonna dry up that tubing. Make another rosette, like so, and 1-inch border. So we're gonna clean that or dry it like so. Drop it. Then one more. border, and at the bottom. There we go. And drop it. So we're assessing the side. It's not swelling. I don't see any redness in there. The patient's not complaining of any pain, so we're good. I don't see any purulent drainage in there as well. There is no pungent odor too. So what we're gonna do now, because it's already cleaned, we're gonna take our gelinet right here. We're just gonna peel it off. Make sure we're still maintaining sterility as we do that. And we're making sure that our gelinet is still within our sterile field. It's far from the 1-inch border. So now this goes to the garbage right here. Drop it from a safe height. And just gonna peel this off as well. There we go. And now we are just gonna twirl that. There we go. We're just twirling that to make sure that it's fully occlusive when we put it on our patient. Just gonna do that as well while maintaining sterility. Okay, just gonna twirl one more. Okay, so now what I'm gonna do is just gonna put one more here. Alright, so I'm just gonna put that around the site right here because we used a larger surface area. We cleaned a larger surface area. It's okay to touch this as well because it's clean. We can use our forceps to touch that area. We're making sure that it is fully occlusive right here. It covers, there's no gaps on where the tube connects to the patient, so we're good. And now I will be using my drain sponge. So, just gonna take that off, and we will be putting this in separate directions or in opposite directions. I'm just gonna put it like so. I'm just touching here where I'm just touching the gauze as well. And now I will be getting another one, and we will be putting that in an opposite direction. So, like so. You can put it right here. There we go. So that's good. And we are also gonna get a 4x4 and put that on top to make sure it is fully occlusive. Like so. And now we're not going to use our sterile field. I can take off my gloves. And we will be putting our MeFix. I'm just going to wash my hands again. And our MeFix right here is already for us. It's already dated and signed. I got my initials and the time and the date for today. So I'm just going to put that right here for now. Just going to put it here in case it falls off. Just going to peel that. Okay. And then I will be getting it, opening it right here. So that's the garbage. And making sure it's in a good spot right here. Just gonna take off that backing or paper in here. Just gonna do that as well. There we go. I'm just gonna make sure I have that taken out too. So just touching the sides here to maintain sterility as well. There we go. So that goes to the garbage. And now I am just going to make sure that it's fully occlusive right here. And I get another one. Just going to peel that. There we go. And now I am just going to peel that as well. Make sure that we tent it right here. So I'm just going to peel this backing off. And I made sure it's dated and signed. I'm just going to tent it right here so that when it pulls, it's going to tug on the dressing and not on the tubing itself. So now I'm going to clean up. I'll do my safety check. I'll make sure that the patient has the call bill within reach. I'll do my safety check. Patient's not in distress, but it's the lowest position, so no safety hazards. I will document that the patient tolerated the procedure and that there's no exudate on the dressing itself. And I will do my safety check. I will do my documentation. I will wash my hands as well, and then I'll exit.